While Oklahoma is a top 10 state in the theft of catalytic converters, we are also a bottom 5 state in the quality of care provided by our state's nearly 300 nursing homes. That's according to a large study recently released by the Kaiser Family Foundation, which states almost half of our state's long care facilities are underperforming. Taylor Jackson joins us now with what can be done to improve those numbers. Taylor.
Yeah, Rich, over 66 nursing homes in the state have received below average ratings. The organization I spoke with says they're working to improve the quality of care in these facilities. 6 years ago, Kinsey Nesevich's life changed forever when her mother suffered a massive stroke at the age of 47.
When she had that stroke, she went to the hospital and they transferred her to a rehab, and then the rehab transferred her to a skilled facility, and a skilled facility transferred her to a long-term care facility.
Nesevich's mother started experiencing chronic urinary tract infections. She even found multiple sores on her mother's body.
She had a cochlear implant on her head, and because of the mistreatment that she was experiencing at her nursing home, it left a very large sore on her head. And all of these things added up are what made me reach out to A Perfect Cause.
A Perfect Cause is a nonprofit organization that advocates for nursing home residents and their families. Founder Wes Bledsoe created the organization after his grandmother died in nursing home care due to neglect.
When I started asking questions about what happened to my grandmother, I saw that this was something that happened far too often.
Bledsoe is pushing for safe, quality care in nursing homes and long-term care facilities. He says the change starts with nursing home care owners and lawmakers.
I've gone up to pro-life lawmakers, lawmakers who claim to be pro-vet, and I've asked them, I know you're pro-life about the unborn. Would you be pro-life with me about people in nursing homes, including our veterans and their spouses, and they turn around and walk away?
With the help of A Perfect Cause, Nesevich began to advocate for her mother.
I sent them an email with all of my claims that I was experiencing with my mom. And they did send someone out on my mom's behalf to go and look at those claims to see if they would be substantiated or not. And I did receive an email back from them that all of the claims, and even more than I had originally sent, were substantiated.
Beyond acknowledging the problems, Nesevich says not much changed after their investigation. Maltreatment referrals can also be submitted to the Adult Protective Services and the State Ombudsman.
So we do investigate complaints on behalf of residents, and we are a person-centered agency and program.
State Ombudsman William Whited says that when requesting an investigation, it's important to keep in mind which departments have the authority to regulate facilities.
That people don't always understand is that this system is big, and people don't understand it until it reaches out and grabs them by the collar, and then they have to start paying attention to what's going on when they themselves or their loved one needs long-term care.
The state long-term care ombudsman can only advocate for the resident. The Oklahoma Health Care Authority and the State Department of Health's Protective Services have the authority to regulate and enforce. DHS Protective Services long-term care can investigate, but does not have the authority to regulate or enforce. Jeremy Buchanan is with DHS Community Protective Services.
Our long-term care referrals that we got in FY22, which would be July 1, 2021 through June 30 of 2022, we received 3,128 referrals of abuse, neglect, or exploitation. I think stronger communities, more connected communities, more active communities definitely help reduce isolation, and that plays a big role in providing a space for people to be abused, neglected, and exploited.
During the pandemic, nursing homes in the United States lost more than 200,000 employees.
There are staffing shortages. Our nurse aides and certified medication aides are paid a fairly low wage. We worked with the legislator and to get a rate increase.
Buchanan says this should help facilities raise salaries and reduce turnover to keep staffing levels more stable.
Participating in the coffee program in some form or fashion.
Care Providers Oklahoma, located in Oklahoma City's Midtown, provides educational resources to healthcare providers to elevate the quality of care available to their residents.
We provide a pretty robust array of education that includes from those very basic care instructions on how to meet your qualifications, but then also on those quality enhancers.
Buck says most of the training they provide is centered around abuse and neglect prevention.
To make sure that we are providing the right care with the appropriate amount of dignity and respect for the individuals. There are seniors, there are school teachers, there are firefighters. They deserve to have outstanding care.
And if you have a loved one in a nursing home or a long-term care facility, Nesevich recommends that you visit them as much as possible.
You put a camera in their room. That is the first thing that you're going to be able to see any issues that go on with your loved one whenever you're not there. My second recommendation would be to visit as often as possible.
A Perfect Cause is set to host a human rights hearing to give victims, family members, and staff the opportunity to share their testimonies. The hearings will begin September 12th this year.